Bueno, pues al parecer ya estamos en vivo. Les doy la bienvenida a esta
It
conversación.
looks like we're live. I'd like to welcome you to this conversation. Let's talk COVID-19 prevention perspectives and realities. My name is Carolina Siliceo Perez. Thank you very much for being with us.
Hi, and welcome to this conversation. Let's talk COVID-19 prevention, perspectives, and realities amongst our Latinx communities. My name is Carolina Solicia Perez, and thank you so much for joining us. This conversation will be completely in Spanish, so if you need English interpretation, please join us on Buncombe County Government's live Facebook feed at buncombe.gov. Recuerden, si se han unido a esta
Remember,
conversación
if you joined this conversation and you need interpretation into English, it's available on the Facebook page, Buncombe County Government.
I'd also like to thank Rocio Quintero y Leo Esperanza from the Sensontle Language Justice Cooperative. Thank you for helping us create multilingual spaces. While we recognize there are many languages spoken amongst our different communities here in Western North Carolina, for now we are only providing interpretation from Spanish to English. Les doy las gracias a Sensontle, la Cooperativa de
I'd like to
Justicia de
thank
Language
Sensontle Language Justice Co-op,
and Rocio Quintero
Rocio Quintero, and Leo Esperanza are interpreting for us today. Thank you for helping us to create these multilingual spaces. And though we know there are many other languages in our communities, for now we would only be offering interpretation from Spanish to English. With that in mind, it's important for me to be transparent and to share that my Spanish isn't always perfect. I say that for myself, but I also extend that understanding to the panelists today to create spaces for those imperfections and realities that make us who we are. Want to get started? If you could please share your name, organization, and position you hold within the organization if you are representing one today, and a little bit about what you'll be sharing today. Let's start with Mariela. Of course, good morning, and thank you for inviting me to this forum. I'm very thankful. It's good to see that we're all cooperating to improve our communities. I'm Mariela Solano, and I'm the director of Project Access in the Interpreter Network, Western Carolina Medical Society. And today I will be sharing about our cooperation in terms of what is happening to prevent and also to help people be updated about the centers where COVID testing is happening. And thank you for including me this morning. Thank you, Mariela. Amparo, would you like to introduce yourself? Yes. Hello, and thank you for the invitation. My name is Amparo Oviedo Acosta. I'm one of the nursing supervisors in the Department of Public Health and Clinical Services in the Department of Human and Health Services in Buncombe County, and I've worked there for almost 19 years. And I supervise nurses who are working with COVID-19 cases. And I have also investigated cases myself. I have participated in activities around planning, coordination, and communication that have to do with this pandemic. And I will be talking about what do I do when my test came back positive. Thank you. Hello, I'm Marianne Martinez. I'm the Vecinos director, and today I will be talking about perspectives and realities amongst uh, day laborers with COVID. We provide mental health and physical health services for day laborers that work in the westernmost eight counties from Buncombe County. We also have a group of migrant workers in Buncombe County as well. Bruno? Uh, Good morning, well, afternoon now. My name is Bruno Hinojosa Ruiz, pronouns he, him, his, and I am the director of SEMA, an organization here in Asheville that struggles for the rights of immigrants. Our work has mostly been around organizing, communicating, and keeping the community informed, helping people get organized and actually be able to access their rights as immigrants in the United States. And I'm going to speak a little bit more about our organization, but going to focus on how we collaborate with other organizations and what we've been doing around COVID and how our work that we've been doing has been affected. Thank you very much.
Buenas tardes, soy
Good
Iliana
afternoon.
Hernández.
I am
Trabajo como
Eliana
coordinadora
Hernandez.
y
I am
especialista en
the
recursos
specialist
del
and
programa
director
de
in resources in
hoy
the
voy a
Consulta
hablar
tu Compa
sobre el
program.
programa
Today I will be
y
talking about our program,
cómo se ve y cómo gente
what it
puede
looks
tener
like, and
acceso
how
a él.
people can access it.
Gracias.
Thank you.
Y bueno, Ernesto,
Ernesto? Hello, I am Ernesto, and I was invited to share about my experience with everything that's going on with COVID. So I'm here to talk a little bit more about that. I also work with SEMA. Hello, Bruno. Greetings to you. Greetings to everybody. It's good to see you here, and thank you for the invitation.
y justamente eso, Ernesto, es un
And
gusto verte,
Ernesto,
aunque sea por esta plataforma
it's great to see you in this electronic platform,
en
this virtual
línea.
platform.
Y sé que tenemos mucho de qué
And I
hablar
know that we have a
y
lot to
mucho
talk
de
about.
disciplina.
But before we
Quiero
get into
empezar
it,
porque
I'd
estuve
like
revisando los
to do an
registros
activity because I've been thinking about how different it is to meet this
virtuales
way
sin podernos
virtually
tocar, así con
without
el
being able
fin de
to greet
comprometernos
each other
ya
the way
tiempo
we
adicional.
would have in person.
Quisiera dedicar algunos momentos
And so I'd
para
like to spend
hablar
some
de
moment,
nuestros
some
compañeros,
time
quién nos acompaña
to
hoy,
see who
algunos nos
is
conocemos de mucho
here
tiempo,
today. Some of us know each other
otros
from a while back.
nos
We're
apenas,
pals.
y aunque estemos
Others
lejos
we just met.
físicamente,
And although we're
tomamos espacio para
separately
reconocernos
doing
y
this
reconocernos.
physically, I'd like to remind ourselves that we're together at a distance.
Así que por lo menos yo voy a
So at
tomar
least
un momento para
myself,
respirar
I will
profundo.
take a moment
eh,
for deep breaths.
Quizás como les voy contando no parezca
As I was saying, it may not
que
look
podamos tener
like
esas
we can
oportunidades para
have
compartir
these opportunities to
diferentes
share,
historias con todo el
especially
sufrimiento
these days with COVID,
que muchas personas nos
amongst
acompañan
everything
para
else.
salir adelante
There's
y
many
tener
people who are
una vida
struggling
digna un
to
poquito mejor.
improve our day-to-day
Muchas de ustedes que
lives.
nos están escuchando quizás
For
estén
those people who are
trabajando,
listening, might be
estén
working,
en el campo
they might be
o quizás no
out on the
están en ese
fields,
momento presente,
they
pero
may not
sabemos,
be
sabemos
present,
quiénes son esas personas
but we know
y
who these people
aunque una
are.
hora no es suficiente para
And
entender
although
todo
one
lo que
hour is
muchos
not
están
enough to
viviendo,
talk about all the topics we'd like to
queremos invitar a
discuss,
esas personas a
I
formar
want to
parte de
invite
esta
those people
conversación con
to
nosotros,
join the
a
conversation with us,
acompañarnos
to
en
be
esta
and
hora.
be with
Y bueno,
us during
recordarles
this hour,
más que nada que
and to
estamos
also
haciendo
remind
una
you
labor
that you
fraterna
are doing
y
such an important
estoy muy agradecida de
job, it's
contar con
important
todos
work,
ustedes acá en
and
esta
I am
hora.
very grateful to have you
Muchas
here
gracias
today.
por
So
acompañarnos.
thank you for being here.
Ah, más o menos tenemos
We have around
pues el tiempo para que cada uno nos cuente
the right amount of time for everybody
cómo
to
ha
tell us a
sido
little bit more about the
COVID-19 y
work
cómo
that
han
you're
sido
doing and
afectados por la
how
pandemia.
the pandemic has affected you.
Mariela, ¿quisieras
Mariela, would
hablarnos
you please tell us
sobre tu trabajo?
a little bit more about your
Sí,
work?
gracias Carolina
Yes, of
por
course.
este
Thank you,
espacio para
Carolina, once more.
conversar.
It's great to be here with you
No
all.
sé si cuántos conocen
I
nuestro
don't know how
programa
many
de
of you guys
Western
know the Western
Carolina
Carolina
Médica.
Medical Society,
En sí tiene el programa de Project
which
Access,
holds the
proceso
Project Access
creado desde el
program.
atención médica, casi siempre es de especialidad.
It always
Ayuda
usually
a las
deals with
personas en
specialties,
ciertos
and it
grupos
works with
étnicos
people
o
within certain
religiosas.
economic groups who don't have
Tenemos
insurance.
una red de intérpretes
We also have the
que
Interpreters
se conocen
Network,
como WIN,
which you guys might know as
ofrecemos
WIN,
servicios de
and we
interpretación
offer interpretation
para
services
idiomas
in 12 different languages.
a la mayoría de las clínicas a las que
And we go
llegamos,
to most of the clinics, to the hospital in
también
Buncombe County,
condados
but
en la área
also
de Buncombe County.
neighboring
Y
counties.
bueno, junto con mi jefa nos hemos
And us,
enfocado
along with my
en
boss,
llevar
we've
información a las
focused on bringing
comunidades.
information to the communities.
Con Dr. Mullendorf
We've been collaborating with Dr. Mullendor to be able to offer
interpretación
interpretation
en los
services
lugares, en los sitios
in
en
the
los que
places
están
and the sites where
llevando a cabo las pruebas de
they're
COVID.
doing the COVID
Han
testing.
sido varios
There
lugares
have been
aún
many places where
y
we've
por las
been,
próximas, yo
and
creo
for the
que
next, I think,
7 semanas,
7 weeks,
vamos a estar 3
we
veces
will
a la semana
be
en
there
esos centros
in
para
those at those
llevar
centers three
información.
times a week because it is so
Nuestras,
important.
nuestras comunidades
Our
muchas
communities,
veces, muy vulnerables en
oftentimes,
estos tiempos,
especially during
están
times like
fuera de esos
these,
recursos
are
públicos
left out of
de
these resources because they don't
acceso
know that
a
there's this access
interpretación,
to interpretation
a distintas ayudas que ellos
and to
pueden
other types of
recibir.
help that they could get.
Entonces, desde el principio, cuando
So from the very beginning,
comenzamos,
when everything started,
dedicamos
we
a
focused on
tener parte en estos
being part
eventos,
of these
estar ahí
events,
presente, ya
to
sea
be
ayudando
there
o si se
either
requiere
helping
ser
or
nuestros intérpretes.
if interpretations
Gracias
needed.
a todo el trabajo de
I want to
ellos,
thank all of the work that they do. They have been there
internacional.
to help in any capacity.
También la organización se ha
The
dedicado
organization is also focused on raising funds
mascarillas que sabemos
to
cuando todo
give
comenzó,
out
las
masks,
mascarillas
which, as we know, when everything started, we had a
también
shortage, and
las cosas
also,
necesarias
gloves, any
el,
kind of
las
gowns,
personas que están,
anything that people who are
perdón, las front lines,
on
en
the
este
front
caso,
lines,
ayudando a
who are out there
los
helping everybody,
los enfermeros
nurses,
médicos, hemos donado al
doctors.
hospital
We have donated those to the
muchas
hospital. We have
áreas,
donated
todo
to many
esto
different areas.
para que las personas que estén ahí
Why do we do that?
ayudando a toda
It's
nuestra
for so
comunidad
for those people who are there helping our communities can have the
eh,
necessary
y
protection.
también repartimos mucha información a
We
través de
also
nuestra
handed out a lot of
página
information through our
y
website
de medios que se pueden
about
tomar para
the measures you could take to
controlarlo.
prevent uh,
Desde
the
que todo
spread.
comenzó,
So when everything started
incluso póngale,
in March, let's say,
nuestra organización hemos
let me say, our organization has been attempting
en
to
cualquier esquinita que podemos meter
get
la
into whatever
mano,
corner we can get
llevar
so that
información ya
we could
sea
bring
en español
information
y en otros
in
idiomas.
Spanish and other languages as
Tenemos
well.
intérpretes, como les he
We
dicho,
have
en 12
interpreters, as I said,
diferentes
in 12
idiomas.
different languages.
Yo creo que en esos
And
tiempos
I
son
think that
cruciales y
during times like
importantes
these, it is crucial, it's
llevar la
very important
información en la
to be able
el
to bring
idioma
this
que
information in the
ellos
language that
hablan.
people
¿Por qué? Porque
speak.
todos sabemos,
And
bueno,
why
yo
is that?
soy hija
Because
de
we all
inmigrantes,
know,
yo
well, I
llegué
don't know if we all know here,
antes, yo
but
llegué
I
sin
am the daughter
inglés,
of immigrants. I
mis
came to this
papás,
country
mis papás
speaking no
también.
English.
Eh,
Same for my
pero
parents.
como
And I
parte de
remember
poder
what it
llegar
was
a
like to
esas
not be able to
personas que
understand a person in my language.
a
And
través de
so
toda mi vida
through my
he
life,
experimentado una cosa u otra
I've
que
experienced one
es
thing or another.
importante
And so I understand the
tener
importance
información
of
como esta
being
cuando
in a
uno está
situation like
comenzando
this
a
without having
llegar.
access to somebody
Imagínate, yo
who
vine
can
hace
help you.
hace
I came to this
33
country
años.
30 some years
En
ago.
ese entonces recuerdo que mi mamá me decía
And
solo
I
hay
remember that
1
then my
hora
mom
de
told me
radio
there
en
was
español
1 hour
o
of
sea, y
radio in
eso para
Spanish
poder
per month.
educarse
So
en ese
1 hour per
idioma,
month.
recibir
So
formación
we needed to
para
see
poder
what we could do
llegar a donde estábamos.
to fit in where we
Entonces,
were.
yo
So
recuerdo eso
I remember
y
that.
lo he visto a través de toda mi vida. Entonces,
And I've seen it through my
desde que
life.
comenzó, una de las metas
Since
de nuestra
this all started, one
organización
of the
ha
goals of our
sido
organization has
ese,
been
esa organización,
to be
esa
that
entidad
organization, to
que
be that
provee estos
entity
servicios
that
a nuestras
provides these
comunidades
services to our
y que
communities
también sigue abogando por ellos.
and that continues to
Espero que me haya
advocate for
explicado,
them. And I
Carolina.
hope I
Gracias.
explained myself well enough. Carolina, thank you.
Claro que sí, y aprovechando ese tema de prevención,
Yes, of course. And
repetitivamente,
and, and
tratando de recalcar
taking
la
that line
importancia
on prevention,
de
I find myself,
proteger, el ponerse un protector
uh,
facial, el
you know,
cubrebocas,
learning how to
el
use masks,
distanciamiento de 6 pies, evitando
make
contacto
sure we have that social
físico,
distancing to 6 feet and
además
avoiding close
tomar
contact. And how can we forget the most frequent and most common
Claro,
piece of advice to wash your hands? Yeah, wash your hands. It's so
o
difficult,
sea,
but it's
las
so simple.
personas creen que verdaderamente
People think
con ese
that
gel
truly
necesario, el
it isn't necessary to wash your hands often to use the masks. I can tell you that at the beginning, it was difficult for me to leave to go out with the mask because I found had a hard time breathing. I had a mask that didn't really work well for me. So many people think that, oh, the mask isn't necessary. Why would I wash my hands all that often? But the best way to prevent any kind of contracting the illness is to use masks to wash your hands. And it got to the point where I started to think, that I don't even go out that often and blah, 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 blah. So I had to make sure that I understood that the mask, may not be necessary all for me because I'm healthy and have a good, strong, healthy immune system. But I started to think about, well, what happens if I leave without my mask on, and I pick something up and then I pass that on to someone who is vulnerable, an older person who has a compromised immune system, who doesn't have the necessary defenses. And so I started to think about that, and I think that we have to be very conscious about that. It's not just about us. We always say we're all in this together. We're all here to fight together. So then let's make sure that we protect each other. And it's not that everybody who has weakened immune systems or older folks who don't have who can't get something over like this. Is it uncomfortable? Yes it is. And someone told me, if a person if there's a store that requires a mask, I'm not going to go. I'm going to wait until this is all done. And then they said, well, why? And I said, because I'm choking. I feel like I can't breathe. And somebody said, you're going to feel worse when they give you when they have to intubate you. And I thought, oh, that's true. If we think about things like that, we're going to understand that what we're doing isn't. Many people say, oh, I have to wear a mask because the government says, or because of this, or because of that. They're controlling me, blah, blah, blah. And what we're really doing is we're just protecting each other and washing our hands.
Muy cierto, Mariela. Gracias por compartir esa información.
Yes, Mariela, thanks for sharing this information. And then we also have Amparo on the other side of the coin, right? When you've had the virus, you've contracted the virus. So, if you could please let us know what is it that you're not just what you're seeing, but what can we do if we have been confirmed to have the virus? Thank you. So the very first thing I'd like to mention is that our objective has always been to work together to be able to stop or slow down um, the virus, because what we don't want is to overwhelm the hospitals and not to have enough rooms for the people who are high risk and that they have to end up going to the hospital. So we're seeing that it's happening in various states in the US, like Florida, Texas, California. And basically, our job is this: our goal is to try to stop or slow down the virus, because basically, when we do the COVID, the doctor or medical provider that has done the exam will call you with the results, but then the nurses who work at the health department, we then call you again. And so we ask, what do you need? What symptoms do you have? Because there's a misconception sometimes in our culture that we just call to like get people in trouble, but that's not our goal. We are nurses and we're nurses in the in public service. So what we want to do is to know how people are doing, if they need help, how can we get the help. We have some resources, like for example, to call 211, or some resources from the county, um, from the state, federal too. But some people in our community do not qualify for this type of state or federal help. So what we always try to find information to give resources to them. I've looked for resources in my own church, in other churches in the community, for cases that I've seen and that basically have to be isolated. The first thing we tell them is, how are you doing, and give them recommendations. So it's kind of scary, but again, we need to prevent for our health system to become overwhelmed, and also to prevent deaths, because many recover from the virus, but some don't. So some people have died, and right now in North Carolina, the 44% of cases of COVID-19 have been Hispanic people like us. So it's out there, it's in the community. When we talk, we basically, when we call, we basically um, not want to know like the details of your life, but we want to know how it is affecting people. So we don't know many things. We don't know what the symptoms are for sure. Like we know the symptoms of what we already know so far, but then again, there's no vaccine, there's no cure yet. So we are learning. We're learning um, uh, about the virus. So what kind of symptoms have you had? Where have you been? Is there anyone else in your family who has the symptoms or have had the virus? And basically, our focus is to isolate people who have the virus, and to isolate them is practically just to stay at home, don't go out, don't get any visitors. If you have your own room where you can just be by yourself, and especially if it has an access to one bathroom, then that's the best. But if not, the county is providing a place for where people can go and isolate themselves, or can do the quarantine free. It's a hotel in Asheville where people who do not have a place to isolate themselves or pass the quarantine by themselves can tell us as the nurses, and then we will be able to provide this place for free with the meals paid for and everything. People just don't know sometimes about the resources that are out there, but what I would also like to say is, please answer the phone. We're not here to uh, get anyone in trouble. We don't want to get anyone in trouble. We I don't want to say it's not in our interest, but I mean, like, our focus is not to know whether people have a social security number or not. That's not what we're there for. We want to help people. We want to basically see more and know more about this virus, so that we can stop it or slow down the spread, because we're seeing that the spread has gotten out of control in some other states in this country. So also, what I'd like to say is, when I talk to people, I always tell them we are here to serve the community. We're not here, again, to get anyone in trouble. So, whatever we can do to give you information or resources or help or recommendations, would like to have people hear us, listen to us, because that's the only way that we can stop this and have some type of normality in our lives again.
Muchas gracias por esa
Thanks so much for that information, Amparo.
tú estás trabajando
Marianne,
con un
you are
círculo
working
un poco
with a
distinto,
sector
podrías
that's a
compartir
bit
sobre
different. Can
el
you
trabajo que está haciendo
share a
con
bit of the work that you're doing with Vecinos? Of course. So Vecinos serves the farm workers in the eight most western state, counties in the state, and we try to increase the primary care accessibility to the, the people, and we also serve with mental health and primary health, and we're the only ones um, who do this integrated work that's bilingual, that's one on one, and we do our work with a medical team, but also we promote health, which is essential to our work. We serve our services with the traditional clinic, but also with the mobile clinic. And now we do telehealth and through the phone. And we just have a new team of health promotion that's only focused on COVID-19 in the Hispanic community. So we have expanded our services beyond, but it's right now only for farm workers. But we also focus on um, sharing resources, health, education, and to create and build relationships, individual or um, by groups. We have relationships that we've already established with the farm workers and the temporal workers. The migrant workers have to travel between states, maybe between Florida and North Carolina, or from Mexico to North Carolina. In our region, this is different from the Buncombe and Henderson County. But in our region, most of the migrant workers come with the H2A. So they have a status. It's not necessarily a legal status. They come with a work visa. And then the temp workers, seasonal workers come for the for only a season, and they work in the types of work like also construction, landscaping, restaurant work, and other jobs that are in high risk. And maybe you can't really practice social distancing or um, as good health practices as we'd like to. So we have some considerations for the migrant workers, which are their conditions of where they live, because usually they live in groups of 4 to 100 people. They share the space, they share their rooms, they share the bathroom and kitchen. Even if they have a visa, where they live is small places, and they're all together. So they also usually travel in groups, many times through the bus system, or they've been using the face coverings in the buses, but when they go to their rooms, I mean, they can't sleep with their face covering, so they're always exposed to the virus. And also, generally, it's a bit different, the considerations between migrant workers and seasonal workers in the um, emotional aspect, because they come here for just one matter, which is to work in the field, to provide for their children who are back in their countries with their families, whatever. So as an example, we have a team of son and father and son, and they both are positive. The father is fine. He has a positive case, but he's going to the field to work every day. But the son has very strong and severe symptoms, and obviously the father is worried about the son, and the son is worried about the father, and among everyone, they're very, very worried. There's lots of things to consider emotionally into that. And the temp workers, seasonal workers, work at different places. They don't really have the same level of legal status or protection by their employers. They have their families and lives um, as much here as from their own country of origin. But if they don't work, they don't gain anything. So it's not like the ones with the visa that have like the protection of 2 weeks of sick leave. If they don't work, they don't gain any money. So that's another consideration that we're working through between vecinos and our positive cases in the most western counties.
Gracias, Marian.
Thank you so much, Marian, for that perspective.
Viena sabemos que es la
I know
temporada
your
donde
hands are
comienzan las
full.
fiestas
This is the
patronales
season
y
where a
pasamos
lot of
por
people are
varios
arriving
estados
or coming from state to state. So,
Estaba pensando mucho en ustedes
so
estos
I've been
últimos
thinking
meses.
about you all a lot during these
Bruno,
past weeks and last month.
¿sigue?
So, Bruno,
Sí. Bueno, pues
hi.
de nuevo trabajo
So,
con CIMA,
I work
soy
with
el director
SEMA.
de CIMA, compañeros y
I'm
compañeras,
the
como ustedes
director
mencionan.
of SEMA,
Para las
and
personas que no saben de
for
CIMA,
those
pues es una
people that
organización
haven't
sin
heard of
fines de
SEMA,
lucro,
it's an
que
organization that
las inmigrantes
fights for the
que
rights
viven
of the
en el
immigrants
norte de
in
Estados Unidos. Nos
the
encontramos en
Western
Henderson,
Carolina, North
Henderson
Carolina,
y
and we also
Buncombe.
work with Henderson and Buncombe in between these two
Tratamos
counties.
de hacer
And
lo que tal vez en
more than
Colombia
anything,
organizar y conectar
is we want to
a
organize and
personas
connect
que puedan entre ellos mismos
people so that
conversar o
they
tener
can organize
conversaciones sobre
themselves
lo que está
and
pasando más que nada
get
con
informed in what's happening, especially with like immigration. And
estos 2 años nos hemos
the
enfocado en
last years,
eventos
we've
en el cual
focused
trabajamos con
on
la agencia de inmigración
creating
de ICE
a relationship
específicamente.
between ICE and
Hemos,
the
estamos formando redes
local police. We're trying
con
to
miembros de
stop that, and
familias
we
que puedan
also
ayudar
have
en caso de
groups
que
of
exista
people
una
that can
avalancha de
help
inmigración y
if there's an
sacar
activity,
a inmigración de la comunidad
immigration
y ayudarlos
activity in our county, so that we can take them out of the community.
nosotros hemos
And
trabajado
we have collaborated with
con varias
many
organizaciones también
organizations,
hacemos
and
como noches de conoce tus derechos
we do like know your
para
rights
poder
nights
etcétera
and
y pues después de
notary
COVID creo
letters.
que todo
And
como cambió un poco
after COVID, it has changed our focus as well. I think it happened like that to various people in this panel.
pero para
But
nosotros cuando vino
for
el
us,
el
when
COVID-19 creo que
COVID
fue
started happening,
pues
I think it was
vivimos
hard
en la
because
comunidad
we live in the
en
community,
el
in
oeste
the
de
Hispanic community in Western North Carolina,
pues
especially here in Asheville. So
lo vivimos
we saw it, we are living it,
donde vivimos
and we
trabajamos
see it
también
with the people whom we work
nos
with
tocaba
and live with.
que pues estaba el COVID
And we heard about COVID, and
que la gente pues se cuidaba a
that
veces
people were
no
trying to
tanto
take care of themselves, but like some people weren't
pero
as much diligent.
nosotros
And
sabemos que
so
esto es un poco
we
más
know
complejo
that this
que
is
uno mismo
bigger
solo, ¿no?
than what we can do. Of course,
No lo va a poder hacer solo.
no group or organization can do it on their own, but
Con la colaboración de aquí de las
with
organizaciones que están en el oeste
the
débil,
collaboration of the organizations that are here in Western North Carolina and
todos
Asheville,
nuestros enfoques
then
las primeras
we try to give our focus in the
más o menos
first 2 months or so to
distribuir
be able to
apoyar
distribute
lo que la comunidad
and
de nuestras áreas
um, giving resources to the people in our community with providing masks. There were people that were doing masks, and we tried to distribute food as well, and a few funds. We know that there's a lot of people that don't have a status who couldn't receive their stimulus checks. So that on that part too, we at least were able to try to do something to respond for people that were going through.
durante las primeras semanas
And during the first weeks and months, we also saw videos and what was happening with COVID, what was COVID, and we tried to tell people to like use their masks and to follow with the state policies and
y
local.
pues lo que sí puedo decir es que hasta la fecha
So what I
que
can say is that up until now,
¿no?
what's been
hay
said
muchas
already,
personas que aún
there are
se
many
ponen
people
máscaras, cosas
who are
así
still not wearing
y
masks
pues
and all that.
más que nada
And so I think that
y de parte de las organizaciones pues
just for myself and from our organization, we need people to understand that this is a pandemic, and I think that our job is focused, or our work is focused on immigration, but we can't let everything else go. So we have been collaborating with other organizations, other groups, to be able to give other kinds of help. We're for now, not right now, collaborating with Mana Food Bank to be able to give out food. And so for us, it has been about modifying certain uh, aspects of our work to be able to give help that's necessary in the moment. So I would just like to say, for people who are watching, because there are people that I know who have had COVID, and those people have told me that I was following instructions, I was wearing my mask, and I still got it. So for people who are watching or listening, to wear your masks, respecting the people who is in front of you, who are in front of you. So this is gonna go for a while. It's not gonna be short lived, but I think that if we take care of ourselves and see each other as people, then this is gonna get better. We need to be able to understand that we can beat this. As many of the people here, I I'm an immigrant myself. I'm from immigrant parents, so I think we've been through so many things, and I think that we can keep going. This is another step, and I think that many of us are here fighting for a better future. That we don't yet know what it looks like, but as an immigrant, as immigrants, we have lived through these uncertain times. So this is just another version of that. But people need to take care of themselves and take care of their families. And that's the message that I'd like to deliver to the community. And one more thing that I'd like to add is that we also worked with Consulta Tu Compa, with Iliana, for people who belong to our organizations. We can create a solidarity fund, and we were able to create it. We were able to help people who didn't receive either state or federal monies, and that's what we were able to do. I know that the need is rather big. There are many other groups that are doing similar work, but that's what we're doing. Thank you.
Sí, es buen punto. Vamos viendo que
That's a good point.
todos
We're
estamos
seeing
tratando de
that
ceder en
everybody
la
is
forma
doing what they
de
can
ayudar a esto.
to work
Ileana,
together in
¿podrías
this.
decirse
Ileana,
qué
if you could share with
consiste
us,
este
I know that you
programa
have the details
Consulta
about
tu
this
Compa?
Consulta tu Compa program.
Sí, Consulta tu Compa
Yes,
existió
Consulta tu
antes,
Compa
pero
came
sí
about 10
han
years ago,
venido a como recrear el programa y
and the
durante
program
COVID
has
es
been
más
kind of
necesario.
revived during COVID because it's
¿Puedes
more
explicar cómo
necessary.
el programa
But Consulta tu
provee
Compa is a
servicios de
program
urgencia importantes para
that
la comunidad?
provides resources
El programa
and
es
referrals that are important to the
de
community. The program is
el
based
EMA, pero
out of the Emma community,
bilingüe en
but it
español
provides
e inglés
bilingual
a miembros
support in Spanish and English
de
to
Buncombe. Si nos
residents
podrías
of Buncombe
detallar la
County
información
who can't
crítica
access
o el
critical
apoyo y
information
los recursos
or the
que
support and
es
resources that
necesario
they
para
need
ayudar, que pueden
due
incluir
to
el idioma,
barriers which could include language,
información sobre
cost of
navegación
services,
por los sistemas,
the
así que
understanding of how to navigate systems, because that it confuses even me sometimes,
como necesidad
and
de
immigration status,
defender a ellos
or
mismos.
the need to
Trabajamos con miembros de
practice
la comunidad
self
para
advocacy. We work
identificar
with members of the community to
necesidades
identify their communities and see what kind of
proveer
questions
información
they have, provide information
y
and
también jugar un
referrals,
papel de
and also
apoyo
to play an
asesorar el
advocacy
uso
role
adecuado
to
y
ensure the adequate
una
support.
variedad de
And
necesidades,
we focus on a different
incluyendo
variety of
identificar
needs,
abogados,
including referrals to
servicios de
attorneys,
teletrabajo y robos de
uh,
salario, apoyo en
lack of
procesos de
funds,
solicitud de pasaporte,
support to
identificación
for applications for passports and identification cards, among many others. We're open from Monday through Friday from 10 a.m. to 3 p.m. And we also work through appointments in the afternoon and on the weekend when it's necessary, because we understand that we all work, and you may not be able to come see us during the time that we are open. And as everybody has said, during COVID, everything has been difficult. And so it's more important for us to be able to provide information and resources to people, because we're all in this struggle together. Well, and speaking of what we're attempting to prevent, or we would like to prevent, Ernesto, I've had the opportunity to speak with you, and in a way to navigate through that system. Could you share a little bit about that experience? Maybe a little bit about when you felt that something wasn't right, and tell us about what this process was like for you. Of course, my name is Ernesto, and I had an experience where I got sick. It was a cold for me. It came on suddenly, but it set my alarms off because I have a family, I have kids and friends. And during this time, I've always uh, taken care of myself, and people from work tell me that I'm crazy because I always have a bottle like this with alcohol. I have soap. We have masks on all the time. If we go to a store, we wear we cover our face, and we have a process. I work in construction, and all my tools, I disinfect them, I clean them, and so when I get sick, my reaction was, How?" But during that time, I I worked under the rain for a while and got wet. As any immigrant would say, well, I'm gonna get wet for a little bit, and that's okay. But then I got sick, and I put some distance between myself, my kids, and my wife, and I looked for medical support very quickly. I started calling different places, and they told me, "Come see us." They gave me an appointment. I got to the appointment, and they saw me outside of the building, and then they go through the process where they put uh, they collect what's inside your nose, and they talk to you about many things. And the biggest fear is when, during those moments when you're thinking, what if I'm sick? What happens if my kids get sick? What happens if my friends, my wife gets sick? What happens then? It's a huge fear. And since I had my test done, the doctor said I couldn't go back to work until I had an answer from them. And I can tell you that it was the longest 7 days that I've ever had. And then I received the call from the clinic. And when I picked up, they said, they asked, "Is Ernesto?" I said, "Yes, I'm shaking. My hands are shaking." And then they said, "You're not clean. You're negative." And for me, that was the happiest day. And all I could say to all the Latinx folks, all of my people, as I call them, is to take care of yourself. This is really serious. And even within my family, we've had friends near Asheville who have passed because of this COVID pandemic. And so friends of my friends who say to me, you know what, we did lots of people who are sick in this area or this town. There are many people who are going through this and don't want to look for help. And I like to say that you need to find medical support. You need to find a way to help us stop this whole thing because many people are not going to see a doctor, are not seeking help, knowing full well that they are sick. I'd like to say to you that life and your family is a lot more important than earning a few dollars. Uh, when you work in a restaurant or in construction, life is invaluable, especially if you have children, if you have a wife. And if you don't have family here, remember that you have family in Mexico or wherever you're from, and they will also suffer because of your loss or because something might happen to you and they might never see you again. And on behalf of myself, I'd like to thank you for the invitation to allow me to bring my experience here to everyone, for your words, and for everything, all the good things that you're doing, wherever you are. Thank you very much, and I hope to meet you guys in person one day.
Y sí, para nosotros tenemos el gusto. eh, Les recomiendo actuar con
Um,
Ernesto.
thank you.
Siempre con su transparencia
I
y
always appreciate
sí,
Ernesto's
lo que acabas de
transparency.
mencionar,
It's a very important
en,
truth.
en los días que más o menos pasaste la experiencia
In those days
de
that
ser
were you going through that experience and waiting for the call,
comunicarte, pudieran ayudar,
or even
me
before
hizo
you found
pensar
out
que
what clinic could
desafortunadamente
you could go to be treated, it made me think that right now
más o
there's
menos lo
a
mencionaste,
schedule
Mariela, pero
that's been designed, as
ahora
Mariela
recordando, sí
mentioned
tenemos
it,
días
but
concretos
there are
de test
now
comunitario
concrete
en las
sites for
médicas,
community testing. On Tuesdays, they're at the Ingalls and Swannanoa.
que están
On
en
Thursdays,
el parque
they
deportivo
are
del
in
condado de
Buncombe County
Asheville, en el
Sports
municipio
Park
de Asheville,
in South
y los
Asheville.
domingos,
And on
que
Sundays,
espero sea un horario
which is
más
hopefully,
flexible,
uh,
de
I
10 y
hope to
media
be a more
de
flexible
4:30 a
schedule
5:30
from
existe la
1:30
primera
to
sesión
5:30.
comunitaria
They're
donde
offering community
puedes dejar
testing
tu vehículo
where
y
you
quedarte
can
un
do the
rato ahí.
drive-through. They can
Claro,
do the
te vuelven a
test,
llamar con esa
and
respuesta.
then they'll call you back
Es
with the
totalmente
results.
gratuita,
And as we know,
no
it's
necesitas
completely
ni seguro
free.
médico
You
ni
don't
seguro
need a social
social.
security number or
Y bueno, inclusive
medical
puedes estar
insurance,
atendiendo de 1:30 a 5:30.
and
Así
you will
que les
be
recomiendo
tested from
que lo
1:30 to
aprovechen
5:30. So I would
y
recommend
puedan
that you take
comunicarse
advantage of these
directamente con
resources,
ayuda.
as we saw
Vemos
in
que
Marianne's
no
case.
se
We
muestran
saw that there are many
muchos
cases where you don't show you're
complicaciones,
asymptomatic,
pero si tienen el tiempo,
but if you have
tengan
time,
tiempo,
make the
vayan a
time
hacerse la prueba.
and
No
go get
tenemos seguro
tested.
de salud, pero si tenemos esta oportunidad al
But if we have this
alcance,
opportunity at hand, I
vale la pena
think
aprovecharla. Y
it's worth taking
respondiendo
advantage
a
of
las
it.
preguntas
So we're going to
que
quickly
nos
go into the
hicieron,
questions that
la
we are
primera
receiving.
en la cual quieren saber
And we
más,
have one where
estamos hablando en general,
someone would like to
y
know, we're
por
speaking in
confidencialidad
generalities
médica no podemos compartir detalles de nombres ni pacientes.
because we know we can't share names or details.
¿Nos
So
puedes
maybe,
decir
Amparo, could you tell us in your
en qué
experience
sectores o industrias
what
estamos
in
viendo
what industries or in what areas are you seeing
la presencia
that
de
people are
personas
more
con riesgo?
affected?
Yes, that's a hard question to answer. Um, because at this moment, the virus is in the community, it's everywhere. So, um, specifically, we at the beginning we were seeing people who were dying. It was more on the long-term care facilities, but that has passed. Now we see we see it everywhere in all types of jobs, all types of people. This virus is not discriminating, unfortunately, and fortunately, we're seeing it everywhere in factories, in restaurants, in meat plants, nurseries. I mean, we see it in medical offices, everywhere, everywhere. It's everywhere. So it's very important for people to do what they see, the three W's in English, which in Spanish is not the same translation, but it's pretty much to wear a mask or face covering. I like to say mask better because we say the cubrebocas, which in Spanish is only to cover the mouth, but like we have to cover our nose as well. So that's why I like mascarilla or mask better. So maintain the 6 feet distance with people whom you don't live in the same household, and not to be in that proximity for longer than 10 minutes if they're not from your household, and wash your hands or use hand sanitizer. So that's very important to do. We don't know everything about the virus. So what we've heard is um, that 40% of the people that have it don't have any symptoms. This comes from the CDC, and yet they can still spread the virus. So what we know so far is that maybe to have it once doesn't make us immune to having it a second time. So maybe someone said, well, I already got it. I don't have to wear a mask. I don't have to do anything. But no, it might be that in 2 months, um, someone else exposes you and then you then again get the symptoms. We don't know everything about the virus, so we just need to keep everything in mind. And unfortunately, just like Bruno said, um, I'm very sad to see that many people in our Hispanic community, and I mean everyone in general, don't follow the rules, don't follow the guidelines. We don't wear our face masks. We don't maintain our distance because we're like, oh, I'm with my family, but who knows if like our extended family is with someone else, you know? So we this can get out of control even more worse than it already is. So regarding the question, I mean it's everywhere. So I don't have a specific answer to where to tell you to take the most care from. So honestly, we all need to take care of each other every day at all hours. Oh, another thing that I'd like to mention before, because no one's talking, is to please don't be afraid to give us information when we ask, um, like who you've contacted in recently, who have you been close to, because that's the only way that we can control the virus. We don't ask you these questions to just gossip or just to know, you know. It's to basically have and give you the recommendations to these people who you've been close to if you had a positive case. So they need to also quarantine themselves. They have to also do the exam, the screening. So that's how we spread it. It's not just like I'm the only positive case. It's also the community that I've been around with. Whoever I'm around and are vulnerable can die. So we should not be afraid to name our close contacts. So again, we don't want to put anyone in trouble. We are not going to get anyone in trouble. We need to learn more about this virus, and this is the way to do it, asking questions and following the guidelines. I have another question, and I see the time, so we have about 6 minutes. So maybe we can take a few minutes for this one question. What are the local resources in which we are certain that the people that are afraid to be deported can go to and receive these resources with no retaliation?
No sé si alguien más quiere hablar sobre eso, pero
I don't know if anyone else wants to talk about it, but I can mention that
no se deberían de
right
preocupar.
now,
Si esa es una preocupación,
that should not be the
no hay por qué
first worry.
preocuparse.
There shouldn't be any concerns for this.
Con
Um,
inmigración. En el
there
momento
in Buncombe County, there's no immigration relationship at the moment, and I think also at the hospitals, there's not this communication in Henderson County either. So this is more a health matter,
si esa es la preocupación
and
por
and
querer ir
if
al
that's
hospital
the
o a la clínica,
concern
no
of
se
why you
debería
don't want to go to the hospital or health department, that should not be your worry.
si piensa que tiene
Um,
riesgo de
if
tenerlo
you
o
think you're
tiene
at
riesgo
risk of having it or have symptoms or know someone who you had direct contact with a positive case, then please call Buncombe County. There's various ways. Whether you go to a free clinic or if you go to the Buncombe County website to do a self check, but to evaluate yourself or assess yourself. But this should not be a worry. If you hear this, please don't be worried. There's no connection with immigration to be detained or anything. Um, but it's a health matter. I don't know if anyone else would like to talk on this.
Carolina, yo creo que eso es un buen punto
Carolina, I
muy
think
importante, que las
that's a
personas
very good
tengan,
point,
primero
that
que nada,
people need to understand that
esa,
they will have
ese
access
respeto en su idioma.
to people who speak their language, and
Uno de
also not
tenemos
to
personas
be
que
afraid
están
that they're going to be
preparadas
detained or anything
para
like
un
it.
médico
They're
en
there
sus
to
idiomas.
receive a medical
Entonces tenemos,
care,
o sea,
and I think we
decirles,
need
enfatizar que
to tell them
si está teniendo síntomas, si
and
quiere ir a hacerse
emphasize that if
cualquier
they have
evaluación,
symptoms and they want to go get
hacerse
the
lo más
test,
posible
please
de
uh,
ir a buscar
don't be
los
afraid. You have all the rights to
también
go
algo
seek the help you
quiero
need.
hacer muy claro que es algo
And something
muy
else
cierto. Tenemos
that
problemas
I
pues
want to
ya
say, well, we always have a lot of
una
complaints, is that when you
cantidad, o sea,
come
mínimo que sea,
to
no
a
es
clinic,
el servicio que
they
ellos
don't
necesitan en su
provide
idioma. Muy
the
importante
service they need in their
decirle
language.
que
It's
están
very important for people to understand that they have their right to ask
todo
for
momento
an interpreter. At
necesitan
any
recibir
point,
ayuda
this is
de
the right
doctores en el hospital,
in a low income clinic or even hospitals. Hospitals receive federal funds, and it's the law that when you ask for an interpreter, then they have to provide an interpreter for you.
a un sitio
And a lot of
que no
people
van a entender
are
o no
afraid to
tienen
go to a
acceso
certain
a
site
alguien
because
que
they
hable
think
su
they
idioma.
don't have access
Y
to
yo
someone
quiero
who speaks
enfatizar
their
que es
own language.
importante que
And
se
I
sepa
cannot
esos derechos y se entienda
underline this
que es
as much,
algo que
that they
es
need to understand their rights. This is something that
demostrado
is
que ellos van a proveerle a
within
usted
their
y
reach
también es algo
to provide for you, and it's the law to provide interpreters. I see connections between panelists to have like future work with this know your rights matter. Thanks for responding to the questions. We don't have all that much time, but I know, Bruno, that with what I've shared with you, you have been very intentional in the way of sharing resources and funds to protect um, to protect um, on this type of detail for the community. So I hope that we can talk about it in the future more detailed. And again, thank you so much to the organizations that fight every day um, to improve the community. There's a lot to do and a lot to keep recognizing the work that's being done. But I think this is the beginning for this. Thank you so much for your time, dedication, work. I'll be seeing you all. I hope that amongst ourselves we keep seeing each other. And since Sunset, thank you so much for being present in these transmissions, and the IT team Max. I mean, if I keep going, I will never end thanking everyone involved.
A
Thank you
ustedes por
so
la
much,
invitación.
everyone. Thank you.
Un placer
Thank you,
estar aquí.
Carolina,
Gracias.
for organizing
Gracias a
this. It's
todos.
great. I'm so glad to have been part of this. Thanks to everyone. Thank you.